So I think one point here, I personally think we have enough evidence right now that I don't think we should scare people. Because right now we don't have strong evidence that it's a risk factor. It may be, but to less degree than other risk factors. So I don't think we should scare people, but I think we need some more research to really assess whether it's a risk factor or not. And in his talk, Dr. Lipton was mentioning the best way to go about it would be a retrospective cohort study looking at migraine earlier in life, and then to actually pick up on migraine, because there is misclassification of exposure, people not recalling they have migraine if you look at people later in life, but then looking at dementia later in life, so we would have a longer time span in those studies, so we can really determine. Then the next question is, if this is a risk factor, then we would need to do intervention studies to see can we prevent it, as a modifiable intervention we could do. Yeah. I think what I said about, I think this is a good question to ask, but I don't think we need to scare anyone either, because fear is not good either. We need to make rational decisions. And then, I don't know, it's not related to this topic, but I was recently co-editor of a book on headache. So I don't know if I can mention it here or not. Yeah, so I'm co-editor with Dr. Carrie Bernstein. She works at Harvard University at the Brigham Headache Center, and it's Headache, What Do I Do Now? From Oxford University Press. So it's a concise, case-based book that really tell you how to go about the diagnosis of, headache diagnosis of different cases, and just the next step in evaluation and management.